Wherever you study medicine, you'll graduate as a doctor. That means that when it comes to choosing the right medical school for you, there are a few key factors to consider. These are clinical exposure, how much time do you spend in a clinical setting, teaching style, how does your medical school teach medicine, area and location, where is the medical school and how will that impact the course, size, is it a big or a small school, and entry criteria, what do you need to get in? In terms of clinical exposure, there are a few key questions to ask of any medical school you're looking at. The first thing to consider is how early in the course you'll start your clinical placements. Some medicine courses will get you into a clinical environment very early, whereas others prefer you to have covered a lot of theory first. Secondly, how sustained is your clinical exposure? When you first start those placements, are you in for half days or whole days? Do you do a placement every week, for short periods of time, or every term for longer periods of time? Finally, think about where you'll be getting this experience. Are your early placements focused in a single setting or across a multitude of different environments? Are you getting a mix of primary care, things like GP surgeries, and secondary care, such as hospitals, or are you doing a lot of placements in one place before moving to another? In all of these, there are both positives and negatives, but really it's up to you how you want to learn and what is going to be best for your experience. Another factor that is key to consider is teaching style. While the content will be predominantly the same over the course of your 5 years of study, the actual style of learning is what separates a lot of medical schools. Traditional teaching universities tend to focus on mastering the theory before moving on to the practical. This involves your first 2 years being focused on pre-clinical study, followed by 3 years of supervised clinical placement. Most of the teaching is delivered through lectures and focuses on all areas of medicine. This style of learning may be most suitable for you if you prefer to learn theory before you get into a practical environment, and you want a clear divide between teaching and placements. Integrated teaching is similar to the traditional approach in that the majority of your early teaching will be lecture-based, but the key difference is that your clinical placements will start in the first 2 years as well. Your lecture-based learning will also link a lot of subjects such as anatomy, biochemistry and pharmacology together into body systems, such as the respiratory system. In this sense, integrated teaching tends to suit those who prefer to balance their theory and practical studies and gradually be introduced to clinical environments. Two newer forms of teaching are problem-based learning, PBL, and case-based learning, CBL. PBL uses example patient case studies and guided group discussion to contextualize a lot of the theoretical elements of medicine. You'll be guided by a facilitator and tutor who are often a practicing clinician in order to help provide a clinical context as well. This style of learning is supported by other teaching styles as well, such as lectures, clinical skills, anatomy and communication skills. And they also tend to offer early clinical placements in order to support PBL learning. CBL uses virtual trigger cases to focus attention and interest into a specific area of the medicine curriculum. This also involves small group work facilitated by a tutor and allows students to understand both the case and the skills and knowledge required to tackle such a case. Like PBL, this is also supported with other styles of teaching and clinical placements. Both PBL and CBL tend to suit those who enjoy group work and collaboration and like to think through theoretical knowledge in a practical context. Another key teaching area for medical schools is anatomy. In order to learn what's going on in a human body, the best way is to have a look inside one. Medical schools will teach anatomy in two different ways, dissection or prosection. In dissection, you'll prepare the anatomical specimens yourself, whereas in prosection, an expert anatomist will do this for you and then you'll examine the specimen. Both have their positives and one is no better than the other. It's just about personal preference. It's also worth thinking about the location of the medical school you want to go to. Do you want to stay local or move away from home? Do you want to go to a campus or a city-based university? Alongside this, you'll be out and about on placements in the area around the school you go to, so make sure it's an area you'd want to work in. Have a look at the trusts the school works with to see what types of placements you could be offered as well. And finally, think about somewhere you'd actually like to live for the next 5 years. Size can also be a contributing factor. Are you going to be studying with a cohort of less than 50 or over 300? And finally, do keep entry criteria in mind. Every medical school has its own entry criteria. You may need a specific number of GCSEs at a specific grade or higher, and plenty of medical schools will specify that you need certain grades in English language and maths. Most medical schools will require biology and chemistry at A level, but some may also offer entry criteria for other qualifications as well. Think about whether you need to do the UCAT or the BMAT, and what scores do you need in them. Make sure you're applying somewhere where you meet the academic criteria. Otherwise you won't even get to the interview stage, and then you'll have wasted one of your choices.